Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, my name is Fajriani from Department of Pediatric Dentistry, Faculty of Dentistry, Hasanuddin University, Makassar, Indonesia. Well, I would like to tell you about effectiveness of catechin extract of green tea or Camelia sinensis on porphiromonas ginggivalis. Introduction. Data from Indonesia Dental and Oral Health Profile on the prevalence of periodontal disease in Indonesia missing 88.67%. Green tea has received more special attention in the last 2 decades due to its favorable result from human health problems. Green tea was on the herbal plants and different type of active component composition when planted in different geographical location from the presentation and time. Salah ini 1 jam dulu deh, terlalu panjang. Tanda. Introduction. Data from Indonesian Dental and Oral Health Profile on the prevalence of periodontal disease in Indonesia missing 88.67%. Green tea has received more special attention in the last 2 decades due to its favorable result from human health problems. Several of periodontal disease or periodontitis and ginggivalis increase with increasing age. Periodontitis disease are commonly suffered by almost all age and are not affected in high or low income countries. Some studies have shown that the polyphenol content of green tea may inhibit the growth of porphiromonas ginggivalis bacteria causing periodontitis. Porphiromonas ginggivalis is one of the anaerobic bacteria that are found in patients with periodontitis. Green tea has a polyphenol content which contain compounds. The most catechin content in green tea in the form of epigallocatechin gallate, which is about 50 until 80%. The epigallocatechin gallate contained in green tea has an antibiotic effect that can work directly and can inhibit the synthesis of existing fatty acid and can inhibit the activity of enzyme present in a bacteria. And then the bacteria considered to be the main factor of periodontitis is porphiromonas ginggivalis. This study aimed to determine the ability of the green tea extract fraction to inhibit the growth of porphiromonas ginggivalis. And then research objectives to find out the effectiveness of green tea catechin or Camelia sinensis against bacteria porphiromonas ginggivalis. Material and method. The green tea is obtained from one of the products circulating in Makassar, Indonesia. Muller, Hinton, Agan Media, Brand Heart Infusion Broad Media, Mike Fairland 0.5. Tannic acid obtained from Merck, Germany. Gallic acid and epigallocatechin gallate are obtained from Sigma aldrich, Dix antibiotic or oxoid and other ingredients. This type of research is experimental laboratory research, and the research design used is post the test control group, design using dilution method, agar and diffusion method. This research was conducted in the microbiology laboratory of the Faculty of Medicine. Research design used post-test only control group design using dilution method, agar and diffusion. And research sample porphiromonas gingivalis bacteria that have been bred and green tea leaf extract or Camelia sinensis that have been extracted by maceration method. The result, table 1, result of the measurement of the inhibition zone diameter in millimeter on porphiromonas gingivalis, and descriptively is seen that the 10% concentration of the catechin extract of green tea has the smallest mean of the inhibition zone in 19.5 millimeter when compared to the entire concentration of catechin extract of green tea. The 40% concentration of catechin extract on green tea has the biggest mean of the inhibition zone in 16.17 millimeter. Table 2, result of statistical, the test the inhibition zone on porphiromonas gingivalis, and after the data normality test, with the Shapiro wheel test is performed, the DMSO negative control group showed E p value smaller 0.105, so that the data were not normally distribution. After the data transformation is performed, a p-value smaller 0.05 is still obtained in the DMSO negative control group, which means the group is not normally distributed. Therefore, further hypothesis tests cannot be performed with the one-way ANOVA and post-hoc LCD led significant difference parametric test, but instead using alternative tests, namely the Krukskal-Wallis and post hoc Mann-Whitney non-parametric tests. Table 3, result of Krukskal-Wallis test. In the Krukskal-Wallis statistical test, P equals 0.1005 or P smaller 0.05 is obtained, which means the alternative hypothesis is accepted. So it can be concluded that the catechin extract can inhibit the growth of the porphiromonas ginggivalis as indicated by the presence of the inhibition zone diameter in different treatment groups according to the concentration of the catechin extract. To find out which group concentration had difference, post hoc analysis must be performed. The post hoc analysis used for the Krukskal-Wallis test of the Mann-Whitney test. And Mann-Whitney test P smaller 0.105 is obtained. For comparison between concentration and comparison between concentration of catechin extract of green tea with amoxicillin positive control and DMSO negative control. So alternative hypothesis are accepted, which means there were significant difference between groups. Table 4, result of post hoc Mann-Whitney statistical of the inhibit zone on porphiromonas ginggivalis in the 40% concentration. At the 40% concentration of catechin extract of green tea, when compared with the 20%, 10%, 15% concentration, positive and negative control has P smaller 0.05, which means there was a significant difference or had a different effect. The table 5, result of post hoc Mann-Whitney statistical test of the inhibition zone on porphiromonas ginggivalis in the 20% concentration. At the 20% concentration of catechin extract of green tea when compared with the 40%, 10%, 5% concentration, positive and negative control and P smaller 0.05, which means there was a significant difference or had a different effect. Table 6, result of post hoc Mann-Whitney statistical test of the inhibition zone on porphiromonas ginggivalis in the 10% concentration. At the 10% concentration of the catechin extract of green tea when compound with the 40%, 20%, 5% concentration, positive and negative control had P smaller 0.05, which means there was a significant difference or had a difference effect. The table 7 result of post hoc man-witness statistical test of the inhibition zone on porphiromonas gingivalis in the 5% concentration. At the 5% concentration of catechin extract of green tea when compound with the 40%, 20%, 10% concentration. Positive and negative control had P smaller 0.105, which means there was a significant difference or had a difference effect. Table 8, a result of post hoc man-witness statistical test of the inhibition zone on porphiromonas gingivalis in positive control. At positive control, when compared with the 40%, 20%, 10%, and 5% concentration of catechin extract of green tea, and negative control had P smaller 0.05, which means there was a significant difference or had a different effect. Table 9, result of post hoc man-witness statistical test on the inhibition zone on porphiromonas gingivalis or negative control. At negative control, when compared with the 40%, 20%, 10%, and 5% concentration of catechin extract of green tea, and positive control had P smaller 0.05, which means that's a significant difference or had a different effect. This question, in the inhibition zone test using catechin extract of green tea or Camelia sinensis on the growth of porphiromonas gingivalis, it was seen that the inhibition zone performance is increased in proportion to the increasing concentration of the extract. Camelia sinensis had many useful phytochemical compounds. This was due to green tea leaves contained tannin, flavonoid, polyphenols, and methyl salicylate compound. In the testing of the slab zone using green tea catechin extract, again the growth of porphiromonas gingivalis, it was noticeable that the performance slab zone increased along with the increased concentration of the extract. An inhibitory effect of green tea extract with the majority content of epigallocatechin gallate depending on the dose given in oral epithelial cell with several inhibitory mechanisms, among other inhibiting some of the expression of porphiromonas gingivalis gene. Involved in host colonization, gains involved in tissue destruction. In addition, both the green extract and its epigallocatechin gallate compound can increase the expression of the protein stress. The study proves that green tea extract or Camelia sinensis has the resistance of porphiromonas ginggivalis bacteria with a concentration of 10% has smallest average salt zone in 19 I'm sorry in 905 millimeter when compared to the entire concentration of green tea extract. The salt zone at concentration of 40% has the largest salt zone in 907 millimeter. And then Camelia sinensis has many beneficial phytochemical compound. It is caused in green tea level, contain tannin, flavonoid, polyphenol, and methyl matrix compound. Conclusion: extract the green water is able to inhibit the growth of porphiromonas gingivalis and is likely to be made a supply or periodontitis preventative. And then green tea catechin extract or Camellia sinensis is effective in inhibiting porphiromonas gingivalis bacteria. The concentration of green tea extract of 5% has the average smallest self zone in 7.967 millimeter when compared to the entire concentration of green tea extract. Green tea extract concentration 40% has the largest self zone in 60.17 millimeter. So now it's your turn to have a healthy gum. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.